All right, so welcome everybody to today's study group. Just a little bit before we get started, I know this is a lot of information, and a lot of this stuff doesn't have anything to do with taking x-rays, but at the same time, it's stuff that you need to know for the test. It is a lot of information, and I apologize, it might be boring for a minute. It's just information today, but it's stuff that you need to know. So I apologize for that ahead of time. Just try and pay attention and take notes. I'll be sending this video out, and I can also send the slideshow out to anybody that wants it. I'll probably just send it to everybody. I know there's a couple people that are copying that and actually making a notebook out of it. So I do have a new study guide that kind of follows along with what we're doing. I'm in the process of putting those together, which is kind of a pain in the behind. It just takes time, but I will get those done and out shortly, so you guys can kind of follow along with what we're doing here. So, you know, I appreciate everybody being here. I did drop a new positioning video yesterday on the Sterling Hub, covering the humerus series, and it's good stuff. If you have questions on how to do certain positions, we'll be getting them all out there on the Hub, which will be good for you guys to review and look on if you need to know how to do something. So hop on there and give it a look. I'm sorry you have to look at me. At least there's Kate and Mikkel there that you can look at. So anyway, let's get started. How's everybody doing today? Perry and Kate, you're the only ones I can see, so I hope you're both doing well. Anyway, hope everybody's doing well. Okay, let's go here. If I can remember how to do this. Just taking a little time. Hey, my good people, can you guys see that okay? Oops.
Yeah, looks good.
Okay. All right, so LSRT training study guide number 3. There we go. Like I say, it's just a lot of information, a lot of me talking. If you guys have any questions, just jump in or raise your hand. I'm not sure how that works, but we'll get this done. So, all right. Let's see. I need to be able to, there we go. Can you guys still see that?
Yeah.
Okay. All right. So we're going to talk a little bit about ethics. Ethics is something that you do need to know for the test. And the ARRT is pretty stingy when it comes to ethics. They have a code of ethics, which we're going to go through, just so you guys know what that is, because there could be questions about it on the exam. So I'm just going to kind of run through this. If you have any questions, let me know. You'll have to speak up because it's all I can see is my slideshow. So, okay. So these are ethics for an LSRT, are administered by the ART, obviously. ART emphasizes the ethics requirements for certification registration. Patients and their families want to know that their medical professionals, including technologists, are qualified, responsible, and trustworthy. Okay. So here's the purpose of it. The purpose of the ethic requirements is to identify individuals who have internalized a set of professional values that cause one to act in the best interest of the patient. So, yeah, basically this is a set of values that ARRT expects you to abide by. And, you know, as medical professionals, we should be doing this anyway, whether you're a technologist or not. The internalization of professional values and resulting behavior is one element of ARRT's definition of what means to be qualified. Exhibiting certain behaviors as documented in the standards of ethics, which we'll go through, is evidence of a possible lack of appropriate professional values. The standards of ethics provide proactive guidance on what it means to be qualified and to motivate and promote a culture of ethical behavior within our profession. The ethic requirements support ARRT's mission of promoting high standards of patient care by removing and restricting the use of credentials by those who exhibit behavior inconsistent with the requirements. So take that. You got to be good. So here's the code of ethics. We're just going to run through them real quick. Number one, and number one is right there about the fourth sentence down. The registered technologist, which if you get your license, that you will be a registered limited technologist, acts in a professional manner, responds to patient needs, and supports colleagues and associates in providing quality patient care. Number two, the registered technologist acts to advance the principal objective of the profession to provide service to humanity with full respect for dignity of humankind, which we all should be that way anyway. We also deliver patient care and service unrestricted by the concern of personal attributes or the nature of the disease, illness, without discrimination on bias of race, color, creed, religion, national origin, sex, marital status, status with regard to public assistance, familial status, disability, sexual orientation, gender identity, veteran status, age, and any other legal base protected by basis. Okay, so that went through a lot of stuff. And, you know, as a decent human being, you know, we all have our likes and dislikes, and we approve of some things and we don't approve of some things. But as a medical professional, we need to look past that, and we need to treat everybody the same. And that's the basis of number three. So just treat everybody well. We practice technology founded upon theoretical knowledge and concepts. We use equipment and accessories consistent with the purpose for which they are designed, and employs procedures and techniques appropriately. Okay. We assess situations, exercise care, discretion, and judgment. Assumes responsibility for professional decisions, and acts in the best interest of the patient. Very nice. So we know that what we do, it is all about the patient, and it's all about treating them well and giving them the best care possible. You know, that goes right into the x-ray room. We need to treat people well. So we act as an agent through observation and communication to obtain pertinent information for the physician or provider, to aid in the diagnosis and treatment of the patient, and recognize that interpretation and diagnosis are outside the scope of practice for the profession. Okay. We're here to work with the provider. You know, it's not our place to give diagnosis, even though it's so hard to do sometimes when you see the same thing that the providers see. Sometimes it's hard to hold that back, but as part of the code of ethics for this license, we're not allowed to tell people what's wrong with them. So we use equipment and accessories. We employ techniques and procedures, perform service in accordance with an accepted standard of practice, and demonstrate expertise in minimizing radiation exposure to the patient. And that's what we're learning. Self and other members of the healthcare team. You know, we're throwing radiation out there, but that's what we're trying to learn, is how to do it modestly and not affect anybody but the patient. You know, we don't want to have a bunch of people standing in the x-ray room when we're taking an image. Registered technologists practice ethical conduct appropriate to the profession and protects the patient's right to quality radiologic technology care. Okay. We respect confidences entrusted in the course of professional practice, respects the patient right to privacy and reveals confidential information only as required by law or to protect the welfare of the individual, the community. We continually strive to improve knowledge and skills by participating in continuing education and professional activities, sharing knowledge with colleagues, and investigating new aspects of professional practice. Okay, when you get this license, you'll be expected to do continuing education, which I think is awesome, even though it's kind of a pain in the butt sometimes. But, this radiology is constantly evolving, and you kind of have to keep up with it. And that's what the continuing education is for. So there are some requirements there after you get your license. The registered technologist refrains from the use of illegal drugs or any illegal controlled substance which results in the impairment of professional judgment or the ability to practice radiology technology with reasonable skill and safety to patients. And that's anything with the medical field. You got to keep yourself and your mind clean. So, all right, so that is the code of ethics. So there is a lot of information there, and you're not expected to know every little thing. All this information you need to be familiar with and kind of know what it is and what's expected of you, because there are going to be questions that deal with all of this. So just being aware of all of it and getting to know what is what it is expected to you. And by no means you have to memorize that or anything like that. Just be aware of what it is. And honestly, it's just common sense. It's what we all deal with every day in our practice. So just be a decent human being and take care of yourself and take care of your patient and keep stuff to yourself that you need to keep to yourself, and you'll be fine. So, all right, patient bill of rights. The patients actually have rights, unbelievably. Right to have access to care. You can secure the service you need in a timely fashion that will ensure the best possible health outcome. Okay, that's why we're here. The right to respect. The patient's right to respect, otherwise known as non-discrimination, is the right to be treated with dignity and respect. Discrimination is not permitted on the basis of race. We kind of already went through this: race, age, sexual orientation, veteran or military status, or religion. We need to be non-biased. We need to treat everybody the same. And, this can be difficult when you've got a belligerent patient that you're dealing with that's in a lot of pain. They can say a lot of things that can be very hurtful. But, you do need to protect yourself, but at the same time, we need to treat that patient with the respect that we would treat any other patient. So, the right to emergency care. According to EMTALA, EMTALA is the Emergency Medical Treatment and Labor Act. And we kind of all probably know about that. It's defined as any medical condition with acute, sudden symptoms or severity, including pain, that without care could reasonably be expected to place the health of the individual or fetus in jeopardy, cause serious impairment or bodily function, and cause serious dysfunction or bodily organs. Okay, that's EMTALA, and we do need to know about that. So let's move on. A little bit more of the patient bill of rights here. The right to informed consent. The most important right that a patient has is the right to be informed, the right to informed consent. You should only consent to medical treatment if you have sufficient information about the diagnosis and all treatment options available in terms you can understand. Okay. The right to refuse treatment. You have the right to self-determination and can refuse medical treatment with few exceptions, such as certain mental health crises. Okay, if a patient refuses to get an X-ray, even though it's in their best interest, they've got that call. So, which has happened to me a few times in my career. People are just afraid of the radiation and they don't want to go through that. And there's nothing we can do about that unless the provider can talk to them and tell them, or us tell them that it really is okay. From an ethical perspective, healthcare providers have the responsibility or duty to protect the life and health of the patient. Ultimately, the patient has the final decision regarding the medical treatment they receive, even when it means they choose to decline such treatment. The right to choose providers. Physicians and hospitals often refer patients to specialist home health care, long-term facilities, and other healthcare professionals for further care outside their expertise or ability to continue continuity of care. These decisions can sometimes violate the right to choose a provider of your choice. All people have the right to choose the provider who renders healthcare service to them. Okay. Last couple. I think there's 12 of them actually. Right to privacy. One of the most basic rights that the patient has is a right to privacy. Patients have the right to decide to whom, when, and to what extent their private individual identifiable health information is disclosed. Legal protections extend to information about, but not limited to, medical diagnosis, treatment plans, prescription health insurance information, genetic information, clinical research records, and mental health records. Okay. The right to an advance directive. You have the right to decide what you want to happen if you face life-threatening injury or illness and cannot speak on your own behalf. This self-determination can be achieved through an advance directive plan. Okay, these are pretty important. You know, I learned this over the last couple of years. A living will to communicate your wishes about cardiopulmonary arrest or CPR, artificial ventilation, feeding tubes, and other measures. Power of attorney, which identifies someone who you've chosen to make decisions if you cannot make them for yourself. Okay, very important stuff. The right to pain management. This is kind of a big thing that we deal with. Healthcare providers have an obligation to relieve pain, suffering, as affirmed by the American Medical Association and other global healthcare organizations. Pain management is viewed by many professionals as human rights. Alleviating chronic pain is seen as an ethical and legal obligation. There are exceptions, especially concerns over the opioid crisis. Access to pain management does not necessarily mean you can demand a specific type of drug or therapy. Patients' rights do have limits, and healthcare providers have rights too. It's got to be the hardest thing that providers deal with, is knowing when and when not to disperse those type of medications. I feel sorry for them in that case. Okay, so those are the patient bill of rights. And you have to be familiar with those, what we can and cannot do, and what that patient's rights are. So I know that was kind of long, and I'm sorry. Medical emergencies. You know, working in an urgent care, we do deal with some emergencies. You know, a lot of them are pretty simple, but every once in a while you'll get something that's kind of scary. A technologist or clinical personnel, we need to be aware of allergic reactions, what to look for as far as allergic reactions are. Cardiac respiratory arrest care, CPR, BLS trained, which we all should be. Then we need to be trained on how to use the AED system. And you will get asked questions about those things as well. In X-ray, we do a lot with trauma and pain. That's just the bottom line. People come to X-ray because they're hurting usually. We need to know how to manipulate the patient with the least amount of pain. And that is something that we learn as we go along, how to move that patient without hurting them any more than they already are. And, you know, I take a lot of pride in that. I've seen technologists that don't really care, and it makes me sad, because there are ways around hurting patients. So be 100% present when you're with the patient. I know that's hard sometimes with our busy lives, and we all have life issues outside of work, but when we're with our patients, whether it be an X-ray or in the clinic, we need to be 100% invested in their care. And it's something that we all need to think about and be aware of. So I went the wrong way. Okay, consent. Okay, consent. The explanation of proposed procedures, treatments, and interventions. Patients should receive a clear and detailed explanation of the purpose, nature, and potential risks of the benefit of the procedure, treatment being proposed. Okay, we need to explain what we're doing in X-ray. Just let them know what they need to do and what's expected of them, whether it be breathing techniques or holding still or anything along those lines. We just need to make sure that the patient isn't in the dark. I mean, X-ray is not rocket science for them. They just know they're getting their picture taken. But we still need to treat each patient the same and let them know what's going on. Discussion of alternative options, which we really don't work a lot with in X-ray. Patients have the right to be told about alternative treatment options, including their benefits, risks, and potential outcomes. Opportunity for questions and clarifications. We always need to give the patient the opportunity to ask questions, clarifying questions, and we need to answer those in the best of our ability. Voluntary consent. It is essential to emphasize that consent should be voluntary. It's the patient's choice without any coercion or pressure from healthcare providers or anyone else, which is hard sometimes because we know what patients need sometimes and they don't understand that. But at the same time, we can't coerce anybody to do anything. So there's verbal consent and written consent, and those are self-explanatory. Okay. Verbal consent is usually done by the provider or clinical staff. Written is an actual signed document. Implied consent. We do a lot with implied consent in the urgent care. In contrast with informed consent, implied consent is a type of consent that is not explicitly stated or documented, but is assumed based on the circumstances of action and actions of the patient of the patient. It is typically inferred from a patient's actions, such as seeking medical treatment or voluntary disclosure of personal health information. When healthcare professionals need to conduct diagnostic tests such as blood tests, X-rays, or the other medical procedure, your cooperation implies consent based on the understanding that these tests are essential for accurate diagnosis and appropriate treatment. So we don't have consent forms in the X-ray department. We don't need to get the patient's consent written on paper to do an X-ray. That consent is implied just from the fact that they are there, and they're there for a reason. So we can just go ahead and do our job unless they don't want it. So, okay, everybody knows about HIPAA, right? Yeah. HIPAA is pretty important. So HIPAA is the Health Insurance Portability and Accountability Act, a 1996 federal law that restricts access to individuals' private medical information. So you look at this and you see a year. Sometimes you might need to know that that was established in 1996 and exactly what it is. We call the entities that must follow the HIPAA regulations or covered entities. So the covered entities include health plan, insurance, HMOs, company health plans, and certain government programs that pay health care, such as Medicare and Medicaid. Most healthcare providers also conduct certain business electronically, such as electronic billing for your health insurance, including most doctors, clinics, hospitals, psychologists, chiropractors, nursing homes, pharmacies, and dentists. It also includes healthcare clearinghouse, entities that process non-standard health information that received from other entities into a standard. Okay. As clinical employees, HIPAA is involved in everything we do in our profession. We need to take HIPAA seriously. Over my career, I've seen a handful of not necessarily technologists, but medical professionals that have lost their job over HIPAA. We need to keep what happens in the clinic, and that's the bottom line. You don't go out and talk to your best friend about who you x-rayed today and what they've got going on. And, if you do, it's going to come back and bite you at some point. So be really careful with HIPAA. And that's what we're trying to get across. Just that's what you need to know is what HIPAA is and why it's important. Let's talk a little bit about communication. We know there's verbal communication and nonverbal communication. So we know that verbal is words, whether spoken or written. They're used in this sort of communication to communicate a message. It falls into two categories, written and oral. So face-to-face interaction, phone calls, and presentations all fall under the category of oral. Emails, letters, and text messages are all examples of written communication. I mean, that's pretty non-explanatory, okay? Self-explanatory. Nonverbal body language. Body language is huge. Facial emotions, and other verbal indicators are used in the style of communication to communicate a message. Examples include body language, posture, vocal tone. Even more so than verbal communication, nonverbal communication has the potential to be strong and successfully convey a message. Okay, nonverbal communication is so important in what we do. If we drudge around the clinic and we drudge around the patients and we just act disconnected, patients are going to pick up on that. And what we do has a lot to do with patient retention, and a lot of patient retention has to do with body language. Be happy to do what you're doing, show enthusiasm, and we'll be better off all the way across the board. Okay, and then cross-cultural communication, that's tough. We deal a lot with that in all of our clinics. But we have things in place to help with that. We either have somebody that can say Spanish, we either have somebody in clinic that can speak Spanish, or we have translation lines. Use those. Try to give that patient the best that they deserve, even a little bit don't speak English. We need to communicate as best we can. So, okay. Visual communication. Transmit a message. This style of communication makes use of visual components, including pictures, videos, and graphics. And there are several ways to employ visual communication, including in charts, infographics, and advertising. It is a frequently employed and simple in living, whatever that is. Difficult information in. I'm not sure what I was trying to say there, guys. I'm sorry, but we all know what visual communication is. Interpersonal communication, information and ideas are exchanged between two or more persons during the style of conversation. Like this style of conversation that we're having now is kind of a one-way street. I'm sorry about that, but I'm just putting information out there for you guys to be familiar with. That's in interpersonal communications. Mass communications. In order to reach a big audience, this style of communication uses mass media, such as what we're doing today, including television, radio, newspapers, and internet. Information that needs to be widely disseminated is frequently done so through mass communication. Okay. For instance, we all probably watched the Super Bowl on Sunday, and University of Wyoming did a commercial. They bought a commercial spot during the Super Bowl. And they did a commercial about Josh Allen and the University of Wyoming, how the University of Wyoming was the only one that really gave him a chance. And now he's an NFL MVP. Anyway, that's mass communication. So everybody who watched the Super Bowl knows about the University of Wyoming now, which is awesome, by the way. Okay. All right, barriers to communication, physical barriers, any form of restriction or obstacle that restricts or impedes good communication is referred to as physical barrier. These could include intrusive sounds, dim illumination, lack of personal space. All those things we need to pay attention to. Make sure that when we're talking to a patient, there's not a lot of stuff going on in the background. So language barriers, we kind of already talked about that one, and we have things in place to help with that. Cultural barriers, we also talked a little bit about that. We're all a little bit different. Different cultures, they react to things differently, and they expect things differently. So these may consist of various traditions, convictions, and ideals, and we have to respect those. So emotional barriers, when people are worried or feeling emotionally raw, emotional barriers might develop. As a result, individuals could find it challenging to communicate clearly because they might be focused on their own feelings, which is very understandable. A person could find it difficult to speak calmly and rationally with others if they're angry or disturbed. And I think we all see that a little bit. And we've all worked out our own ways of calming somebody down or getting the information out of somebody that we need who is emotionally distraught. Empathy is a big thing. Just sympathize and empathize with the patient. I don't know that you may or may not understand what they're going through. Usually that helps calm the patient down. That we're all there for the same reason. So cognitive barriers, individuals with any degree of comprehension or understanding cognitive barriers may develop. Things like lack of information or attention, examples of this. For instance, if a person is trying to interact with somebody who has a cognitive impairment, the cognitive barriers may be difficult for them to comprehend one another. It's very true. Perpetual barriers. People with various perspectives and perceptions may encounter perpetual hurdles. This can involve things like a loss of focus or comprehension. For instance, perpetual obstacles may make it difficult for people to comprehend one another as they're trying to speak with someone who has a perpetual impairment. And that definitely is hard sometimes. Technological barriers, we all deal with that a little bit. Technological obstacles can arise when people have varying degrees of access or expertise with technology. And that's what we're trying to do with this little X-ray program is we're going to break through that barrier of people not knowing about X-ray and how it works. So just a little example there. Noise barriers, we talked a little bit about that. Just keep noise down. Ergonomics, the study of people's efficiency in their working environment. Okay, I know somebody that can't say ergonomics. Anyway, that's just a joke between a couple of us. Anyway, ergonomics.
Still can't say it.
Yeah. Sorry, Kate. Ergonomics looks at what kind of work you do, what tools we use, and your whole job environment. The aim is to find the best fit between you and your job conditions. Examples of ergonomics changes to your work might include adjusting the position of your computer or keyboard, being sure that the height of your desk allows your feet to rest flat on the floor. Is Lindy here? Well, if she is, she may have trouble with that one. She's really short, but we love Lindy. Okay. Learning the right way to lift objects to prevent back injuries. Okay. Using handle coatings or special gloves to suppress vibration of power tools, which we don't deal a lot with, of course. Making sure you have good posture in whatever you do. Okay, ergonomics are important. In the medical field, we're going to be doing this for a long time, and good ergonomics are important. For instance, I just had carpal tunnel surgery, and that has everything to do with good ergonomics. I've made some changes at my desk and it seems to be going a little bit better. But things like that are important. Pay attention to your ergonomics. And it's just something you need to know about. No matter what the job is, the goal is to make sure that you are safe, comfortable, and less prone to work-related injuries. Okay. OSHA's big on that. Patient monitoring. We're almost done, guys. Assisting patient with medical equipment. We really don't do a lot of that here in the urgent care versus the hospital. Sometimes we do have to deal with oxygen or wheelchairs or something like that. But we need to know how to do that. Patient monitoring and documentation, very, very important. Vital signs. Know and be proficient with vital signs acquisition and monitoring. Okay. We need to be good with our vital sign taking and monitoring. When that patient's with us, whether we're checking a patient in or getting their information or drawing their blood or whether they're in x-ray, we need to be able to monitor that patient and see if something's going on with them. Just pay close attention to them. Physical signs and symptoms, motor control, severity of injury. That's one that we really need to pay attention to. Severity of injury. If that patient is hurting or is notably has a fracture, we need to treat that patient with the utmost care. And that's where it comes into being able to manipulate a patient without hurting them any more than they are. Our patients are most important. We always need to keep their best interest in mind. And that's basically what all this is about, is treating our patients the way they need to be treated and the way they deserve to be treated. And, I talked a little bit about patient retention in the urgent care. And a lot of that has to do with this. The care they receive once they walk through that door, that's what they're going to remember. And that's what they're going to tell their friends and their families. And if we treat them poorly, we're going to lose them and, possibly lose anybody that's associated with them. That's why it's so important that we keep their best interest in mind always and treat people with respect and a kind touch always. Okay, guys. So I know that was a lot of information. It's kind of boring, but at the same time, it's stuff that you need to be aware of. And I think if we can do that, we'll be in good shape. So anyway, that's all I have for you today. Next time, we'll hopefully jump into something a little more interesting. So I see we lost about half our audience, so that must have been really boring. Anyway, but it's stuff that we need to know. So, and that's the only reason I'm putting it out there is it's stuff you need to be aware of. So we'll do another one of these next week, and hopefully it'll be a little more interesting than it was this week. So anyway, I will post this to the hub, and I will also send out copies of these slides so you can put it together if you want to. So you raised your hand, Kate. Did you mean to raise
What
your
is
hand?
the age limit for the pregnancy consent form?
I believe it's 9 to 56. Last I heard, or 55 or something like that. It's a huge range.
We have a page, a little blurb listed at the Nampa clinic, and I don't know if that was AFC or Sterling, but it says 10 to 65.
Okay. Well, that's bigger than I thought it was. But yeah, anybody that's of childbearing age, and they can start pretty young. We need to get that consent from them. So yeah, good question, okay? Appreciate it. Okay, guys. Well, I'll get this sent out, and I promise next time will be a little more exciting. So anyway, keep working hard. I look at x-rays daily, and you guys are doing a great job. So keep up the good work. I appreciate it. So thanks for stopping by, and we'll see you next time. Okay, see ya.
Thanks, Eric.
Yeah, you're welcome.
Thank you, Eric.
Thank you.
Ashley. You're welcome, Kate.